Hello, I'm Dr. Dennis Embry. I'm a prevention scientist and a child and developmental psychologist. Everywhere I go, parents, teachers, business leaders, civic leaders ask, what can we do about the rising rates of ADHD, conduct disorders, depression, and other problems facing our children today? Until recently, there was no clear answer to that question. Then, in 2002, the U.S. Centers for Disease Control funded the first population-level study to test the impact of providing practical parenting supports to every family with children 0 to 9. Dr. Ronald Prince, professor of psychology here at the University of South Carolina, is one of the principal investigators of the CDC study.
This study produced two major findings that we're very pleased with and that we think can make a difference. First, we were able to reduce the number of children in foster care placements. Why is that important? Foster care placement disrupts children's lives and families, but it also costs the community a lot of money to maintain those kinds of placements. We were able to reduce that. Secondly, we were able to reduce injuries, child injuries that resulted in hospital or emergency room treatment. And that was another way to cut down on the unfortunate consequences of family issues that have gone awry. And we were able to reduce that.
What is Triple P?
It's an acronym. It's our positive parenting program, but it's a resource. It's something that we have in our toolbox.
Triple P is a system of parenting information designed to help parents manage children in healthy, positive ways.
Triple P means support for every parent. That there is always something that as a parent you can learn in many, many different ways. And Triple P is a way for that kind of information and support to be a natural, everyday part of your world as a parent.
Governments and families provide medical vaccines to protect our children from common childhood diseases, such as mumps and measles. Triple P is a behavioral vaccine that parents and governments can offer to protect our children from common and costly difficulties such as ADHD, conduct disorders, exposure to violence, and other problems. And it costs less than those medical vaccines.
We have parents who, they're really fed up. They're upset. They don't know what to do. They tell you, I'm trying, but I'm not sure what to do. And when we can bring them the knowledge from the Triple P program, you see that it calms some of their anxiety. They feel good because, okay, I can try that. I can try that in my home.
It's almost like magic when you see people turn around and embrace and understand this method of working with families, because it's a different way of working with families that gives them respect and the respect that they need.
Oftentimes when parents presented to me in the mental health center, they were just at their last straw and at their wit's end because their child might have been kicked out of 2 or 3 daycares and they were 3 and they didn't know what to do with that. So when I presented to them something that was just packaged in such a neat manner and such a user-friendly manner that they could put to use immediately in their household and also give guidance to their daycare provider, and saw benefits from it immediately. And we practiced those role plays in the office and saw how their child responded to it. That was what parents took home with them, was that immediately they saw some benefit.
As a result of using Triple P, we have seen adults change because now they come in smiling. They come in and they can talk with us about, they're more willing to talk with us about the situation that they face because they know that there is somebody there who's going to listen to them and who will help them providing some information that can help them work through the situation. We feel as if we have happier parents.
It gears to everyone. It considers the Hispanic family, the Asian family, the Afro-American family, all families. They're all parents, no matter what culture, what language you speak or you come from.
When you get parents who are using these kinds of techniques and they start talking to other parents about what they've done and how successful it has worked for them in changing their child's behavior, I think that spreads to other parents, which spreads to the politicians, which spreads to the media. I mean, you know, it's what, the way our world works in terms of communication. That's what happens, and I think the positive message gets out there.
You can tell the impact, just the impact over the first couple of years of media within the Triple P here in South Carolina. This is just, these are just some of the clips that we have gathered, and these were over the first couple of years of the Triple P project here in South Carolina. So you can see that we have, and these are all listed out by county. So in every county, we've had multiple articles and lots of coverage. It's bursting the binder.
At Paxos.org, we've created an estimator that allows you to calculate the human impact and the cost savings of Triple P implemented in every state of the Union. For example, in California, implementing Triple P would save some 8,000 children each year from experiencing child maltreatment and $75 million each year for their care. In addition, that same implementation would save 16,000 children each year from having lifetime conduct disorders, and those lifetime conduct disorders typically cost $1.4 million per child over their lives. In sum, that alone would save $22 billion.
I feel an obligation to use this program. I feel an obligation to do anything I can. If you look above some of the doorknobs in this building, you'll see the acronym, WIT, whatever it takes to help that child, make them successful. And if we can help prevent child abuse at an early age, you look at a child's lifespan developmentally and the positive impact that can make on a child's life, through their middle school years, teenage years, hopefully college, adulthood, and to stop that cycle of child abuse. The impact that the program can have, it's immeasurable. It's immeasurable.
I invite you to do what all of us can to bring these practical, proven parenting supports to every state, to every community, and to every family, and to every parent, to protect all of our children for all of our futures.